from our last report. We know that children want answers, and to be honest, we do too. Some of the increases due to the way children are identified, diagnosed, and served in their local communities. Although exactly how much of this is due to these factors, we do not know. To understand more, we need to keep accelerating our research into risk factors and causes. The tracking CDC does gives us more than just a number. Tracking provides a complete picture of autism, helping us to understand how communities identify children with autism. We see how the number and characteristics of children with autism vary across the country. For example, the numbers vary from 1 in 210 children in Alabama to 1 in 47 children in Utah. We're also making the most of our tracking system by expanding to include younger children to help early intervention planning and to find important clues about risk. To help communities use our tracking data, we have prepared a community report, and there is community reports outside for all of you. The community report provides an overview of the ADAM network findings in a format that is useful for parents, providers, policymakers, and other autism stakeholders. Included in the community report is a page devoted to each state in the ADAM network. These state pages provide site-specific data on the number and characteristics of children identified with autism. The state pages also include contact information for the site and local resources for children with developmental disabilities, their families, and the professionals who serve them. We brought copies, as I said, of the community report. You can also download a copy of the community report at www.cdc.gov/autism. Tracking also helps identify potential risk factors. Because of our tracking, we know more about how advanced parental age and premature birth contribute to a child's risk of having autism. We're also using what we've learned from our tracking system to evaluate factors that may have changed in the community and may be impacting the chance that a child has autism. For example, we have examined how changes in pregnancy factors, such as more children being born prematurely or at low birth weights, may affect the increase in the estimated prevalence of autism. In this analysis, the selected pregnancy factors did not explain more than 1% of increases in the estimated prevalence of autism. Work is ongoing to examine other factors. Tracking guides our research and the research of other scientists across the country. At CDC, we're conducting the largest study in the United States to help identify factors that put children at risk for autism. This study is called the Study to Explore Early Development, or SEED. SEED is comparing young children who have autism, children who have developmental problems other than autism, and children without a developmental disability from the general population to better understand characteristics of autism and genetic and environmental factors that might affect child development. In SEED, the environmental factors we study are very broad and include characteristics of the pregnancy, birth, and newborn period, and the first few years of life to see what might affect a child's risk for autism. A paper describing the methods of the study was recently published, and initial results are on the horizon. The search for the cause of autism has been elusive, but the one thing that has become clear is that there are multiple complex causes. The work to identify causes of autism is important and challenging. At the same time, it is important that we don't lose sight of the many individuals, families, and communities that are struggling with autism today. While the picture of autism was once discouraging, we have a new focus on the diversity of the autism community and the hope for full and productive lives. Although many individuals may need lifelong support, a growing body of research tells us that the earlier a child with autism is identified and connected to services, the more the child will benefit from intervention. Our tracking tells us that there are many children with autism who are not being diagnosed as early as they could be. We've also heard from many parents, like many of you in the room today, that you were concerned about your child long before the child was diagnosed. And we're working hard to change that. CDC has tools to help families track their child's development. These tools are free and on our website at www.cdc.gov/ActEarly. We're also putting them in the hands of doctors, child care providers, and parents, with a special focus on populations with health disparities and low resources. CDC is helping states to get children into services sooner. Over the past 3 years, we've established Act Early state teams in all 50 states to develop and implement state-specific plans to improve early identification and entry into services. In 24 states, these Act Early teams are also supported by our Act Early ambassadors who promote early identification. Together, these Act Early teams with representatives from public health, medicine, education, and advocacy are working to improve collaboration across the many early childhood programs and services in these states. Importantly, we have developed national goals that will help track progress in early screening, diagnosis, and enrollment in services for children with autism. We work with partners from other federal agencies to establish for the first time a Healthy People 2020 goal focused on autism screening, diagnosis, and enrollment in services. These measurable goals are really important because our data show that typically caregivers or service providers have concerns about a child's development before the age of 2 years, but most children are still being diagnosed much too late, as our data show after age 4. CDC remains committed to playing a vital role in the federal response to autism. CDC's current budget for autism is $21.3 million for all activities, including tracking, research, and awareness. This includes $9 million for tracking, $9.7 million for research, and $2.6 million for autism awareness activities. We know that reporting estimates of 1 in 88 children with autism is difficult news at a time when families and communities are working hard to make ends meet. However, important gains have been made in autism, and these gains must be built upon through research in interventions and causes, and by improving access to needed services and supports. Autism is one of just a few conditions that has a federal committee tasked with coordinating autism research activities. It's called the Interagency Autism Coordinating Committee, or the IACC. Congress passed the reauthorization of the Combating Autism Act in 2011, which has made the IACC and other important federal work on autism possible. Each year, the IACC reviews research results to help direct the national research agenda for autism. CDC's work is a key part of this larger coordinated effort. The IACC also completes a comprehensive review of autism research funding across both the federal and private sectors. According to the most recent autism research funding report for 2009, the federal government provided 76% of the total autism research budget, or roughly $314 million. The Adam Network findings we have shared with you today can be used to make plans to support children and their families. Understanding the characteristics and number of children with autism is key to promoting awareness of the condition. For example, the information can be used when advocates are working to bring a community together to address the growing needs of individuals and families living with autism. More children than ever before are receiving services for autism. Knowing how many children have autism and the characteristics of those children can help educators and providers to plan and coordinate service delivery. Understanding the characteristics and number of children with autism can also help identify important clues for future research. For many communities, out-of-network data have served as the basis for the creation of research consortia, task forces, and commissions focused on coordination of autism activities. Through CDC's work in autism over the past 15 years, we know more about which children are more likely to have autism. We know at what age they are likely to be diagnosed. And we know whether progress has been made in diagnosing children with autism early. This is the information communities need to plan for services and understand where improvements can be made to help children. Thank you all again for your attention and for this opportunity to discuss our latest findings from CDC's Autism and Developmental Disabilities Monitoring Network. Thank you.